Hello everyone. So today we are gonna cover remaining antibiotic part, and before that I would like to say that for FMG, don't be afraid and just revise multiple times, because I have cleared in first attempt, so you can also clear it. It's not that hard also, but you have to be persistent. You have to focus daily. You have to read daily. You have to understand daily. So it's like persistence is key here, mainly, and you have to understand, you have to focus on most important knowledge which they often ask in many times in like exam again and again. So let's start. So basically we are gonna talk about in antibiotic class portion. I will divide this video into two parts, because otherwise this video will be so long. This page will be, and this back side also. So I will divide into two parts, and this one will be completed, this topic. Okay, like antibiotic chapter will be completed today. So let's begin. Sorry. So protein, in antibiotic there are protein synthesis inhibitor. So in the ribosomes we know there is 30s protein and there is 50s protein, we know that. So as an I will tell you one mnemonic. Before that, let's focus here. 30s mnemonic and the 50s mnemonic in ribosome. So as mnemonic we can remember like buy at 30 and sell at 50. What does it mean? We will see here and you will easily understand. Just focus right now over here. So basically here will be what? At and this cell. See, I have highlighted it, at and cell. Okay, I will highlight. So this is like at and cell. Okay, like aminoglycoside, tetracycline, then there will be like streptogramin, then erythromycin, then linezolid, then lincomide, okay, then clindamycin and all. Okay, so these are. And how? So let's focus here. For example, if we talk about the tetracycline, then in tetracycline what it will do, for example tetracycline, it will act on 30s ribosome. So due to that, what will happen? The bacteria will not able to grow. Okay, the bacteria will not able to grow, hence the bacteria will be eliminated. Okay, so that's how these drugs are acting. So that's how we are remembering. For example, this aminoglycoside is also acting on 30s. Okay, and then this streptogramin, it will act on 50s. Okay, because it is coming in cell S. Okay, then from E there will be like erythromycin. It will act on what? 50s here. Okay, then linezolid also act is here. Linezolid also act on 50s. Okay, that's how you will remember easily, and they ask it also most of the time. So okay, then let's talk about the protein synthesis inhibitor. So in that there will be tetracycline, like we can use for gram negative and gram positive, then I have already told you it's bind with 30s ribosome, and there will be like bacteria growth will inhibited. In the tetracycline there will be like in drugs, cycline name will repeat. Okay, in every drugs of the tetracycline group there will be cycline coming. So like doxycycline, tetracycline, etc. One key factor of the tetracycline, that it should be given on empty stomach. Okay, often what happen is that the patient is taking it after eating his or her food. Then what happen is that it will not like act. Why? So because the tetracycline absorption will get impaired because of food. So the stomach should be empty while giving the tetracycline. Also the patient should not be on like calcium or iron or milk, because they also like inhibit its absorption, or they also impair the absorption of the tetracycline. Okay, then use there can be by the mnemonic large corona beer makes up. Okay, that is just for mnemonic. For example, like LGV infection, then lymph disease, then leprosy, these LL. Okay, so these LL by this one. Okay, so it is used in this disease. Then atypical pneumonia, like atypical pneumonia, then after that anthrax also, then after that there will be rickettsia. Okay, and then there will be granuloma inguinale. Okay, so just follow the mnemonic and you don't have to go into too much detail. You don't have to learn it, you have to learn mnemonic. Then from E it will be like entamoeba, then from C it will be chlamydia, cholera, then from B brucella will be there. Okay, then M for malaria, here will be malaria. Okay, then for U it will be like, and malaria the in like patient, if the patient is traveling for less than 6 weeks anywhere, then we can give this tetracycline. Okay, then another one is urethritis. Okay, which is caused by, suppose if it's caused by the mycoplasma hominis, that time we can also give tetracycline. Okay, then another one is like prophylaxis of plague, for that time also we can give. Okay, so this mnemonic is completed over here, so we have to just remember the mnemonic and we can just read it one or two time. Then another one is this one. Okay, then another one is side effect of the tetracycline. So basically the tetracycline is the nephrotoxic, so it should be avoided in case of like a kidney failure patient or kidney disease patient. It should be avoided because it is nephrotoxic. Okay, except this like tetracycline, doxycycline, minocycline, doxycycline and tetracycline. Okay, so these are basically, these can be given in case of like nephrotoxic also, because they will not act on the kidney. Okay, so that's how. And now contraindicated is like in pregnancy we should not be giving the tetracycline, for example, because if we are giving in pregnancy, what will happen that the fetal will develop their tooth enamel dysplasia. Okay, their tooth have a layer, right? So tooth has a layer above, this is called as enema of the tooth, and this will be like a dysplasia of it. Okay, okay, then another one, there can be retardation of bone growth. So means the here fetus bone will not be able to grow properly, or there will like the fetus appearance will also be short. Okay, so that's why it is like contraindicated in pregnancy also. Okay, then comes the aminoglycosides. For in an example of aminoglycosides, we will see in aminoglycosides what happen is that it will act on 30S ribosome, as I've already told you, and then bacteria will not able to grow. So now the examples of aminoglycosides are streptoglycosides, then the examples are basically the like streptomycin, kanamycin, tobramycin, neomycin, and the spectinomycin, and the capreomycin, gentamicin, and another one is this one, that is netilmycin and amikacin. Okay, so basically these are aminoglycosides. So aminoglycosides is also another form of antibiotic. So where we're gonna use it, for example, streptomycin and gentamicin, these two are like commonly used in practice, and these are drug of choice for the plug infection and also for tularemia. Okay, as well as these drugs are drug of choice in adding of the like in patient with pseudomonas or the enterococcus. Okay, then as a mnemonic we can remember like the sac is used in the like as a like secondary drugs in the TB. First in TB we give that rifampicin and isoniazid and all, you know that. Then after the second, if you're talking the secondary drug, like after these drug, if we want to further give any drug, so like let's not go into too much detail because the TB portion will come in the PSM part. So like whole management is there. Let's first discuss here. So basically which drug we can give as a secondary line of agent for the TB. So the drug will be by the mnemonic of SAC, that is the streptomycin, and that will be amikacin, and that will be like capromycin, and that will be like kanamycin. Okay, so like streptomycin, amikacin, kanamycin and the capreomycin. Okay, then the aminoglycosides have certain side effects. For example, it can lead to ototoxicity. What does it mean, ototoxicity? We know that auto is used for the ear, so ear toxicity can happen. Okay, so patient can feel like hearing loss or something, so ototoxicity can happen as a side effect of the aminoglycosides antibiotic. Then there can be nephrotoxicity also, and there can be neuromuscular toxicity also. So if there is neuromuscular toxicity, we should avoid these aminoglycosides antibiotic in case of the myasthenia gravis. In myasthenia gravis we should avoid it. Okay, then another one is this one, that is chloramphenicol. It is another drug, another antibiotic, so it causes the gray baby syndrome. Okay, as a side effect. So these also comes in exam of 10. Okay, then another one is macrolide, we will cover in next video.